A student confidently raises their hand, starts to answer a question, and delivers a completely incorrect response. In that split second, you face a choice. Do you stop them right there, or do you let them finish? Interrupting too quickly can shatter a student's confidence and derail their train of thought. But waiting too long might allow bad habits to harden into permanence before you have a chance to correct them. Before you can decide exactly when to intervene, you have to diagnose why the incorrect answer happened in the first place. You have to separate an accidental slip from a true gap in knowledge. We start by defining a mistake. A mistake is an accidental slip-up. It happens because of carelessness or a momentary distraction, and if pointed out, the student can usually fix it easily. An error, however, is a structural gap. It happens because the student genuinely lacks the knowledge or understanding to get it right. They cannot fix it without your help. Unless you know whether you are dealing with a simple slip or a missing foundation, any attempt to get the student back on track is a complete guess. Effective remediation requires an accurate diagnosis first. When you diagnose an immediate need, you deploy a hot correction. This means addressing the issue exactly when it happens, stopping it dead in its tracks. Imagine you are actively guiding a small group of seated students through a new concept, closely monitoring their progress step by step. You can issue a hot correction using nonverbal cues, often called total physical response. A quick hand gesture or a subtle shake of the head prompts the student to realize their misstep and self-correct, all without breaking the conversational flow of the group. Alternatively, you can use a verbal correction, explicitly stating the correct form or immediately reteaching the concept out loud so the student hears exactly what went wrong. Either way, this immediate intervention acts as a surgical tool. It fixes a highly specific issue without derailing the momentum of your entire lesson. But sometimes, immediate intervention actively works against your goals. Think about a student delivering a 2-minute presentation or attempting an extended reading passage. In these scenarios, you use a cold or delayed correction. You let the student finish their entire thought, allowing the timeline to move forward even as issues pop up along the way. Your role during this time is entirely observational. You stay quiet, taking notes, and gathering data on those issues to prepare for a targeted feedback loop after the activity is completely finished. By holding back, you prioritize the student's ability to build confidence, maintain their flow, and complete a complex thought process over achieving perfect, real-time accuracy. Let's put this into practice. You are observing a peer collaboration group working on math problems. A student confidently starts using a completely wrong formula because they were absent for yesterday's lesson. Based on our diagnosis rule, this is an error. It is a genuine lack of knowledge, not a simple misstep. Pause the video for a moment. Decide whether you would use a hot or cold correction here, and justify your choice. Learning to pause and analyze these scenarios in real time is the difference between a classroom run on guesswork and one driven by deliberate strategic assessment. In that scenario, you need a hot correction, using a verbal explanation or reteaching strategy. Because the student lacks the core knowledge, letting them continue means they will spend the rest of the session practicing the wrong formula. You have to intervene immediately to prevent them from cementing a bad habit. We can standardize this decision-making process into a unified framework. Step 1 is always your diagnosis. Determine if you are looking at a careless mistake or a knowledge-based error. Step 2 is determining your timing. Choose a hot correction to stop bad habits immediately, or a cold correction to preserve flow during extended tasks. Step 3 is selecting your action. Depending on the severity of the issue and the setting, you execute either a clear verbal explanation or a subtle, nonverbal physical cue. While assessment identifies exactly where a student has stalled, the choice of remediation strategy provides the specific support they need to address that gap and achieve mastery.